you do not have to break your back and sell things to buy very expensive moisturizer. So the one I tell people, the very basic one is Vaseline.
Wow.
Just normal
Vaseline.
Vaseline.
Yeah.
It's a treatment for eczema.
Yeah.
You know, there's nothing wrong with chemical pills. It matters whose hands you are under and what type of pills and what you're aiming to get. And you know, there's nothing wrong with actually something that like vitamin C. It's also an antioxidant. It's good to use vitamin C during the day because it protects you also against pollution and all that, and protection. So if you're able to do just that basic thing, fair and well. For the products, if you have acne, oily skin, you can look for products that are either water-based. If it's makeup, there's water-based makeups. And if you can look for oil-free, you know, products, you know, less. Some will be written for acne skin, comedogenic, non-comedogenic, things like that. You have an oily skin. If it's the opposite, try.
Two peaks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow. That's what we're all about. Come on, join our family, let's reach a shine. Games and challenges, excitement in the air. Friends and guests joining.
Hi guys, welcome to today's show, our Health Corner show, where we have a dermatologist who will be handling some skin issues that we encounter from day-to-day activities. But before I introduce to her, we are at a very lovely location, Esri Hotel, who have very many amenities from conference rooms, hotel rooms, and very amazing rooftop hotel where you can bring in your loved ones and also hold your meetings and your lunch hour meetings. We can't also forget to mention our main sponsors, Grace Park Medical Center, who will also tackle a lot of issues, and we're also going to list in everything that they deal with and all the consultants that they have. Welcome to the show.
Thank you.
If you could kindly introduce yourself.
I'm Dr. Gashiri Kapiri, a dermatologist or a skin specialist working here in Meru County.
So we'll jump right to it. Of course, we keep mentioning dermatologists, and you know, to some of us, we think, you know, a dermatologist is just a bougie doctor. So if you could tell us, what's the difference? How do we distinguish, or what's the difference between a dermatologist and just the
other doctors? So we are all doctors. It's good you've asked that, because I've actually had a number of my patients who come to see me and they have another problem, and they ask me if they can see a doctor so that they can handle that other problem. And a number of times, you know, we have to remind them we are also doctors, you know, not you know, just the skin, but generally we are all doctors. And you go to school and you become a doctor, work for some time, and then you specialize. So when you talk, like in Kenyan system, when you talk of a physician, that's a doctor, but then specialized in, you know, adult bodies, mostly inside. That's why it's called internal medicine. Then there's different types of surgeons, and then now there are these more of you know, smaller areas that are not really known much, like you have an eye doctor or an ophthalmologist, who people confuse with an optician. I was looking for the word optician, but opticians are not doctors. Ophthalmologist is a doctor. I had to clarify that. And then now you have ENT surgeons, you have radiologists are also doctors. Those are, you know, doctors that take, you know, do MRI and read them and things like that. So, and that's where also a dermatologist comes. So a dermatologist is also a doctor. Then you specialize and deal with mostly skin issues, hair issues, nail issues. Those are the main 3 areas. But as we say, always the skin is like, you know, an eye. So we actually end up diagnosing so many internal diseases from a patient who just came with a skin issue. So you can't really separate and say this is, you know, skin and it's not any other disease that can affect the rest of the body. So yeah, mainly skin, hair, nails, but most of the skin issues will be related to internal issues, and we do manage those as well. Or sometimes now we have to link up with maybe the physicians, the surgeons, to actually manage a single condition that is manifesting in all the areas. Yeah, I hope that clarifies.
It does, it really does. Now, while we are still clarifying now, so how would one now distinguish I need to see a derma or I need to see any other specialist?
So generally, what people, the public, know is that you see something on your skin, you go to a skin doctor. Okay, I should start saying that skin doctors have not been there in Kenya for quite a while. And even right now, they're very, very, very few. So it's good if someone has any condition, you seek medical advice, and medical advice, of course, is a hospital setting, whichever doctor you get to, because if we say if you have something on your skin, you look for a dermatologist, then we are cutting off like what 90% of the population. So it's good. But if you have access, let's say now like people in Meru or around, not in Meru, but around Meru, and you have access, it's good if you have anything, practically anything to do with your hair, anything you see on your skin or, you know, affecting your nails. Not only seeing, of course, most things you see, others you feel, you know, so there are people who just have nothing on their skin, but they either scratching or they're feeling some burning sensations, or, you know, they're losing hair or all those sorts of feeling. They're losing color. You know, color is not really sometimes even feeling, you know, it's good they access a skin clinic, and likely most skin clinics actually in Meru now, we have a plan that, you know, they are cascaded. You go to any skin clinic, you likely actually see a skin person. We have clinic officers. I'm sure you know there's a doctor and there's a clinic officer. So clinic officer is also a clinician, and we do have clinic officers who've gone back and done dermatology. So they are clinic officers that specialize in dermatology, and we have quite a number actually in Meru. So you go to these skin clinics. If it's something they can handle, they handle it very well. If it's something they can't handle, then they cascade it up now to a dermatologist. That is not the skin doctor. So yeah, that's generally it. So it's advisable if you have access, if anything involving those three areas, just go to a skin doctor if you have access. And from there, so they will likely handle most of the things. But if your skin then is just, your condition is just something on the skin, but needs, you know, another different doctor, then we refer you accordingly.
So now we'll jump right to it, because like you said, skin is quite broad. If we would say it to cover it today, we'll just cover it the entire night and still not get done. So I chose two topics that I feel most people are dealing with, because now when it comes to eczema, yes, it also affects adults, but you're noticing more and more kids are being affected, and people don't really have the know-how how to handle it. We also have lots of myths about it, and then there's this part of acne now in adults. I'm thinking let's start with eczema. In layman terms, what does it mean?
Okay, so eczema. So eczema, it's a very huge, what I can say sometimes, eczema it's like saying headache. And headache can be a million causes. You didn't take water, you have an eye problem, you have a tumor. Okay, not all headaches are tumors.
You might just scare someone here right now.
You have issue with your blood pressure. You know, all these things can cause a headache. So eczema is a very broad term that means describes different rashes that we get on the body.
Yeah.
But I know very well what you mean is a type of eczema that is called atopic dermatitis. Actually, the correct term for the eczema I believe you want us to discuss is atopic dermatitis. So atopic dermatitis generally is a skin condition, and it's a chronic skin condition. Chronic means this is a condition that we really cannot cure it, but it's manageable.
Yeah.
It can be controlled, it can be managed. And it's actually more common in children, according to the population. Practically now we'll talk about Meru, not anywhere else.
Yeah.
More common in children. There are children who start months old. There are children who start when they are a little older. And then there are those who start as, older, way older children, teenagers. And then, of course, there's adulthood, atopic dermatitis.
Yeah.
So what eczema or atopic dermatitis is, in the best way for the public to understand, is a skin barrier problem. Our skin is meant to keep what is in, to keep what is out. And then there are other functions, of course. And if you have eczema or atopic dermatitis, that barrier is interfered with. So generally the best example I like giving even to my own patients, and actually sometimes it's also used in school for the simplest understanding, is like a brick house. There you put cement and bricks and cement and bricks, and they're tight, and there's a way they're interlocking. So if you interfere with either the cement, especially the cement that is filling in between, it's easy for even the bricks to fall off. Or if you pour water, it can actually go through. And if whatever is outside can easily get inside. So eczema, it's more or less, actually the cells are arranged more or less like that. And then we have like lipids, we'll call them like mafuta. Practically, it's the moisturizing factors, there mafuta that are in between, and they try to lock these cells, and it's tight, and it keeps everything inside, what is outside. So if you interfere with any of this, if it's those lipids, that cement, for example, then that's where you find people with atopic dermatitis. Now, that's the problem they have. They have this interference of that. So they lose moisture so fast. So the skin is very, very dry. They are also not able to just produce enough moisturizing factor, mafuta. They're not able to produce enough, so it's very dry. Then things that are outside can easily irritate them because that barrier is not intact. So they get irritated. It's not even an allergy, but things that were not supposed to cause a problem, they'll find their way. Either germs or just pollen or anything will find its way, and the skin will easily get irritated. And whenever the skin is irritated, the body tries to fight whatever has come inside the skin. And in the process of fighting that, there's a lot of inflammation. Inflammation is when it gets red, irritated, itchy, because the body is also trying to fight all these things that are affecting it. And generally that is it. So the child will have a very dry skin, and then it's oozy, it's itchy, it's red, it has a rash. That is generally what is happening at that moment. So, and they usually outgrow it. There's a lot to it, but that's the explanation I'll give for the sake of whoever is listening. We are targeting, of course, the public. If a child gets eczema when they're very, very young, the likelihood is they will actually outgrow it earlier. If they get it a little older, we really can't predict much, when they'll outgrow. But most kids, when they start very young, they outgrow. A very small percentage will persist to adult age, and it does actually change how it presents later in life. So you see most kids will have eczema around their cheeks. you know,
Yeah,
it's
yeah.
itchy, red, rashes, oozing, or just very dry, dark patches on the face. And then mostly on the back of their hands, mostly, you know,
Yeah.
around their knees. And then it can now go anywhere else. And then when they are a little older, or even now in adults, it will appear mostly on the inner side of the hands, neck, you know, the back of the knee. So in children, you will see that it's affecting, just as we've said, the inner side of the hands.
Yeah.
Older children
Yeah.
and adults, the inner side of the hands, the neck, and of course it can go anywhere else.
Yeah.
And in other cases, it's localized. So there's someone who just come with eczema just around the eyes. You know, just the eyelids, and
Yeah.
they are itchy. And this is not an eye problem, just general, just the skin. Others around the umbilical cord, you know, just, you know, localized areas.
Yeah.
And that will be generally the presentation. And there are those now that will start in adult age.
Yeah.
I did mention that. And most, you know, the questions are, why didn't I have it when I was younger and all that?
Yeah.
And what I keep telling people, you know, the body is not fixed. It's always, even our own skin, actually, it's always renewing. Every a month or so, you have cells, new cells that are formed, and they find their way up to the surface. You shed them, and new ones are formed. So it's like a machine. Anything can go wrong at any point, as long as, you know, it's live and going. So eczema can start at any age. Apart from saying that, what I need to mention is that it's manageable. Very, very important to know is that it's manageable. And what I'll share mostly is, first, of course, you need to see a doctor and know all that. It's a spectrum. There are those who will have an extremely mild eczema that we just use moisturizers and we are done. And then it goes to moderate to severe. And it's not stuck. At some point, someone had mild, it gets worse. Other times, you had a very bad eczema or atopic dermatitis, then it gets better. But I know you'll ask, so I'll just say it. There are basic things that every person needs to know. If their child has eczema or atopic dermatitis, or a big child or an adult or a teenager, if you have atopic dermatitis. And those is, it's like Bible truth, you know, you stick to that, and then now we add these other things. So generally, as we just said, is that you're not, the person with atopic dermatitis, you're not producing moisturizing factors, mafuta, as I said, it's not natural, ya kawaida, it's not enough. So for us to protect your skin and to try mimic the normal skin and repair the skin barrier, then we need to practically moisturize. It's like we're trying to replace that. So that's number one treatment, actually. It's moisturizing. Moisturizing means kupaka mafuta, you know, and that's why you see as, you know, prescribing, number one, every prescription is moisturizers. So there are some very good moisturizers. Then there are those that will be a bit expensive. And then now we have just basic moisturizers. So there's something for everyone according to how you're able. You do not have to break your back and sell things to buy a very expensive moisturizer. So the one I tell people, the very basic one is Vaseline.
Wow.
Just normal
Vaseline.
Vaseline. It's a treatment for eczema, for atopic dermatitis. And this you have to keep, you know, putting on over and over. So if you don't wait for your skin to get dry and then you apply, no. So if your skin is getting dry, you know, after this period of time, then don't wait for that period of time to end. You know, even kids that are going to school, I tell them, the parents, they have to speak to caregivers in school, their teachers, they need to understand this condition, and it's not contagious. You know, most people will fear the rash and all that. It's not contagious. You know, just wash your hands, smear some Vaseline on the child. That's the biggest treatment. And then we need mild things. We say the skin barrier is not okay, so we want mild things that will not irritate that skin that is not so intact. So for example, we'll just say use very mild soaps or soap substitutes. So because I'm very passionate about the normal person, so I'll just mention the normal things. So when I say normal is the the citizen, mwananchi.
Yeah.
So, for example, when we talk about soaps, you can use Sunlight. Sunlight, we've realized, is a very mild soap. Actually, it will not irritate the skin. The normal Sunlight that we know, that's a very cheap thing. The other available ones, I hope they'll pay me.
They really should.
Sour soap, for example, the white sour soap. Then this normal sour, you know, the white sour soap is also not that harsh for the skin, and it's very cheap. And then we have Dove, for example. Dove is available in the supermarket, not very cheap currently, but for the person that is able to. So these are the accessible soaps that we can substitute with. But then there are other medical soaps. They're actually meant for someone that has eczema or atopic dermatitis, but they'll be a bit pricey, unfortunately. And those we actually prescribe for someone who is able to. But I'll mention the kawaida mwananchi one. So those, if you think your child has eczema, dry skin, and all this, it's good to use that. Sunlight, simple, available, cheap soap. Then clothing. Anything that is touching a child, an adult, anyone with atopic dermatitis cannot be wool. Wool will really irritate it. You'll, as I tell people, itaamsha shida. I have to use terms that
I know
my
everyone
clients,
gets.
So you wool touches your skin, blankets touches your skin. Boshori,
And we love, you know, keeping them warm.
Boshori will raise, you know, the very nice gifts we get from our grandmothers, those sweaters that, you know, the knitted ones, that unfortunately will be a problem. And then there are the shows and all those things that we cover kids with. Those will be a problem, unfortunately. So we try, wool is the worst, but we try to tell mostly parents that you use cotton clothes for your kids. Being in Meru, Kakoromone. Kakoromone, the second-hand clothes. Actually, you find very, very good quality. Eczema is worse in Western countries, actually, and very common. So, and you know, these things come from there mostly. So the second-hand clothes in our Kakoromone, you get very good quality cotton clothes. All you need to do is wash them very well, you know, hot water, you know, and all that, and rinse them very well. Those cotton clothes will be, actually, this is exactly what I send my patients to Kakoromone. You don't need, because getting good quality clothes, you pay also a lot. Not everyone that will afford that. So clothes, blanket, you can put a blanket in a duvet cover. Duvet covers are also available cheaply. You put blanket inside that, or use a duvet. That is cotton, but I prefer duvet cover again, because you need also this to be washed regularly. You know, you don't put one duvet cover for very long time for a child or person who is affected with atopic dermatitis. And then now, generally, the rest and clothes, it's good if you just use a simple bar soap to wash the clothes. You avoid the powders, the softeners, all those, you know, those type of detergents with. Actually, you've noticed when you rinse your clothes, it doesn't, if you've used powders, it doesn't matter how many times you rinse, the water will be very clean, but there'll be some bubbling and all that. So when that dries, it's there, okay? And then it will
definitely go on top of the skin.
Exactly. So it's good to use a simple bar soap, rinse very well, and you're done. So when you wash or you take a shower or a bath, you make it very short. Make the shower very short. Again, we don't want very hot water. So hot things will worsen atopic dermatitis. It will make the skin drier. It feels nice, actually, but it will make things worse. Even for normal skin, actually, you shouldn't really be taking hot showers. So it's worse now if you have atopic dermatitis. Make it a short bath, lukewarm water, short bath. And now before the child dries completely, you smear the moisturizers. If it's your Vaseline, just smear it, and you know, a lot before the skin is dry. The rest, those are basics. We cannot negotiate that. The rest is, there are those maybe they run on the grass and, different things will just, make the eczema worse. Also, if they have other infections or they have gotten a flu or any other problem, the eczema might still, flare up.
Yeah. I know you've mentioned, of course, the soap for the common Mwananchi, but you hear someone say, I tried Sunlight, it's not working. I tried, the mild ones, they're not working.
Sure.
And also now, in terms of the clothing and everything, you're saying what they should avoid, what they shouldn't avoid. But there are some now who will wonder, because like you're saying, shows need these things for us even before birth.
Yeah.
Sure. Now, is there a way of telling, like, can it be genetic? Is there a way of telling that maybe there's a possibility in my family, this is something that I should look out to, like, the other condition that we look out to, we look out when, you're pregnant, or now your child has been born, they don't have the patches yet. How can you really tell if maybe we are heading to that right direction?
Okay.
Yeah.
So I'll start with the first one. So when you use even these moisturizers and soap, what usually the patient expects, if you tell them use this soap, they expect the soap is supposed to cure. That's the problem we have. Or if it's Vaseline, remember it's a whole 360-degree thing. So we are trying to look for things that will not make it worse. Okay. So you're using this soap. This soap is not really a treatment. We are just avoiding things that will make it worse. So if your, for example, your atopic dermatitis was very mild, what I've said will manage. Okay.
Yes.
But if it was not very mild, you do all this and you say that you did all this but you're not getting well. It's because it needs something extra. Likely we need to do something extra for your atopic dermatitis to be managed. There are those that will have severe ones who most of the time they are on a drug they are applying because it's severe. It doesn't mean the moisturizer is not working. It does. If you're not using them, then it will be way worse. Okay. For knowing if your child will have or genetics, yes, it's usually in the family. Okay, sometimes you can skip generations. Sometimes one person could be having asthma, maybe an adult has asthma in the family, or they could have an allergy of the eye. The same person could have everything or two or one, or their relative has one of those things. So another person could maybe even have food allergy. Okay, another person could have rhinitis. Rhinitis is when you sneeze, actually, So all these things are kind of related, and sometimes as one person can have one, it's called an atopic match. Like you have one, it clears, you get the other, it clears, just like that. But others just have relatives with one with two, another one with everything. Actually, I have clients who have practically the entire spectrum of those conditions. So it's in the family. So if you get twins, they are likely, especially totally identical twins, they are likely going to both have atopic dermatitis. Others, the siblings have different severity. So it is in the family. So when you get all your children don't have to get. You can get one child with and the other one totally nothing. There's really no way of telling. When you have a child, there's no really clear way of telling if this child will have or not. But if it's there and you have other kids, it's just good to be a bit careful. You're not treating anything but just basic things, like what we've just mentioned. Those are just basic things. And then now watchful waiting. We call it watchful waiting. So if you see that the skin is a bit dry, then you need to do a little bit more on moisturizers. And then now when you feel it's getting a little more than, out of your hands, then of course you consult a skin doctor and they'll advise you accordingly.
Now, in so many other conditions that we go to the hospital, the doctor tells us that, what you also consume, what you putting in your body also matters. When it comes to eczema, does that matter?
Generally, I would say Not really, but the truth is that what we eat matters a lot in all aspects of life. This is in eczema or atopic dermatitis, there is inflammation. And over time and studies and all these, we realize there are those type of foods that will just make everything worse in your body. Same story, sugars, refined things, and all that. You will always, there's no benefit, you know. And then, of course, over time, we've also realized there are those foods that are good for your health. And actually, some of them, like when we talk of colors, we're talking of greens, yellow, all those colors. So it's more fruits, vegetables. They have a lot of anti-inflammatory properties or things. So, and whatever this condition is, atopic dermatitis, whatever is happening is inflammation. So if you're having more of anti-inflammation things in your body, then you're helping your body. That's why, when you're sick, you'll be brought fruits. I don't know how it started or just because it's easier, but I think it might have started somewhere because actually when our great-grandparents know these things, So, all these fruits and vegetables and all these things actually help your body to recover. So it's the same story, nothing strict, but generally anti-inflammatory, colored. I tell my patients colored things, and less of non-colored white things. White is not a color, so we want less of white things coming from wheat. Sugar is white, all those things. Less of that, cakes and all that, and more of colored things. So when you talk of also snacks and soda, remember sugar is white, so no colored, no non-colored things. Less of that, more of colored things. Colored things will always be the best for your body in all aspects, actually. But maybe to add on that is that this I need to mention because most health workers, when I say health workers, it's everyone, every level of health worker, from maybe history, is that anything on the skin and it's itchy is named as an allergy. And unfortunately, everyone is told the allergy is protein allergy. And that actually is doing a lot of injustice, especially to the children. All children everybody need protein to grow, for all, how important proteins are. So like us here in Meru, we cover all the way from Tharaka Nithi, coming this, actually all the way even from Embu, coming this side, up this side, like Kipia side, Marsabit, all the way Moyale, and it's more of mashinani, if I can call it like that. And the first access mostly to healthcare workers, we have so low levels of health facilities and all that, and that is one of the biggest problem I get. So children are coming from these areas, and some actually are they are malnourished, and mostly it's not lack. Sometimes it's because of these restrictions, So since they were kids, they have that they had atopic dermatitis. They are told no protein. Totally no protein. And parents stick to that. It's as the Bible truth, and it's doing more harm than good. So what I'll say is that atopic dermatitis really is not a protein. It's not even an allergy in the first place. It's more sensitivity, as I tried to explain. Sensitivity to the outside because your skin barrier is not so perfect. So very few, and we don't even talk about food allergy, like even in the first or second sitting with patients. A very small percentage will actually have an issue with some foods, and likely it's not even protein. Maybe it's wheat, maybe it's a fruit, maybe it's things that are not related at all. And now that takes a different course for us to figure out what could be contributing to making the atopic dermatitis worse. And most mild, moderate will never have any issue to do with protein. So watoto wakule protein.
Waache kunyima watoto protein.
So for those specific cases that it's not even atopic dermatitis, but they might have some intolerance, issues with milk, issues with proteins. Actually, parents know parents, the mother will always, most of the time the mother will know. And they'll tell you, when I give an egg, when I give this, they get this eruption. But now what I tell parents or everyone, don't say proteins. We don't want to hear proteins. We want to hear what. Is it red meat? Then you need to replace with white meat. Is it milk? Then you need to look cow milk. Then we might try goat milk, camel milk, you know, things like this. Or, you know, more or less something around that. And thank you for that chance, because that is very, very important.
Very crucial. Hey, Dr. I am sure you've really covered most of the questions that I've been getting even about eczema, because I once had a guest who really highlighted of how they really struggled with their child with eczema, and that's also where even most of the questions erupted from, and I felt we really needed to tackle that. So for anyone who might have a child or might have someone in their lives that is struggling with eczema and you're wondering where to start or where to go, Grace Park also offers dermatology clinics where you can go and get a dermatologist who will listen to you, look at your child or whoever it is that you're bringing in, and will be able to handle and advise accordingly. Now we will take a short break, but when we come back, Daktari will be handling a topic that mimi mwenyewe I'm excited, you know. There's a lot of things flooding the market and you're wondering as a lady, where do you start? And do we cleanse first? Do we tone first? Is it necessary? You know, and when do we start using anti-aging? That one, sana. We all don't want to get old. Mr. Kikuzeeka. So let's take a short break. We'll be right back.
2 weeks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, excitement in the air. Friends and guests join you.
Are strong in the heart of Middletown. Grace Park lights the way, bringing hope to every frown.
Hello, my name is Maureen. At Grace Park, we believe in transparency and communication. As a patient, you have the right to receive respectful and compassionate care, to be informed about your diagnosis and treatment options, and to have your privacy and personal health information protected. We understand that your experience matters. We guide our patients through every step of their healthcare journey, including coordinating appointments, providing emotional support, and ensuring you understand the treatment options. At Grace Park, we go over and beyond to prioritize these rights, to ensure our patients feel safe and valued.
Grace Park's legacy, guiding every flight. Grace Park Hospital echoes through the hall. Grace Park Hospital, answering.
Hello, I'm Jelinda. At Grace Park, patient trust is the cornerstone of our practice. We are dedicated not only meeting the expectations, but also exceeding the standards of the care and privacy. We go over and behold to create safe and supportive environments where patients can focus with their wellness journey.
We value your feedback. It is invaluable in helping us understand what we are doing well and where we should improve to meet your high standards of care. Talk to us via our customer support line that is available to you 24/7 on 0111 053 800 or through our social media platforms.
Welcome back, guys. How do you like our new location? As I mentioned, we are at Esri, which is located at Nakumatt Kenuru Road. You can really not miss this building. It's a maroon building. I'm sure I'm not messing up with the color. It's a maroon building. Have you checked out the rooftop? This is me totally kuwaibia Mwakenya. Where? Rooftop. Hapo hata kama amesema no, she's going to say yes to you. Now, before we even get to the exciting topic, there's something I forgot to ask Daktari. So you find that, of course, notice my child has something on their skin, and instead, of course, going to the doctor, I've gone to the chemist over the counter, gotten something for them, a cream and something, I've come and applied it. How do you handle that? Am I doing more harm to the child, or am I even helping the situation at all?
Okay. So you are more likely doing harm than good.
Yeah.
So the things that I mentioned when we were starting, that's basically home care that a parent should start, and anything beyond that, it's good to seek, doctor's view on the same. And as I said, there are different also types of eczemas.
Yeah.
And we need also to differentiate which is which, because sometimes we just have a contact dermatitis. There are those who just have issues.
Yeah.
We'll have another day maybe to talk about
this,
all those
definitely.
others.
Yeah.
So there are those who have touched something and they're actually, it looks like eczema, but we need to, I mean, it's an eczema, but it looks like atopic dermatitis. We need to differentiate. And the reason I said you do more harm than good when you apply creams over the counter is most people assume everything on the skin is fungal. Actually, patient comes and tells me, I have fungal. We really need to know that everything on the skin is not fungal, but at least now people have started knowing there is this eczema. But now the problem is that everything else now is eczema, fungal eczema. So, and I will not mention any company particularly, but companies might have taken advantage of this bracket thing, and what they have done is they have come up with combinations of things. Okay, so a cream will have 3 different things. Other creams will have 2 things. Sometimes you also use something with 2 things, but the moment you're starting to use something with 3 things, likely it's just shooting in the dark. Okay, and most of the creams that are sold most in our pharmacies, even hospitals, unfortunately, is these combinations. And most dermatologists will totally be against these combinations, because the moment you've given that, if it was a fungal, most of these combinations have steroids, and that is where the problem is. Because if you have, let's say, a fungal infection, it's actually fungal, and you're giving these steroids, they just sweep under the carpet. They hide what we are supposed to see, but you never get well. So when you come to us, we also can't tell, because you've missed what we were supposed to do. So most of the time we'll tell clients, stop this, come after 2 weeks, and it's very unfair really, because they were coming to get help. But going back to atopic dermatitis, we do use steroids actually to manage atopic dermatitis. But steroids are very different. It's like a ladder, there's a very mild and you go up. And the higher you go, the stronger they are, and the more side effects you can get. So as we are trained and we know how to take care of steroids, when especially you are treating a child, there is a steroid you cannot apply on your face, but you can use on your leg. You can't apply under your armpits. There's a percentage you are not supposed to use on a child, but you can use on an adult. There's a certain period that you should use whatever percentage, whatever strength of the steroid. And this is where we go wrong. So mostly a child will be given a very strong steroid, and worse, it's on the face, of which I wouldn't have used even in an adult on the face. Okay, and they will apply, and of course it's anti-inflammatory, and it's very strong. Sometimes even 2 days, 3 days, and it's gone. It's like a miracle. So what will happen? This mother was not advised, by maybe someone didn't give right advice that you should only use for this time, and then maybe step down, and then you stop using it, and they'll be very happy. They have discovered, and steroids are cheap, unfortunately. So they'll keep going back, applying the steroid, going back, applying the steroid, and then now the list of the side effects of the steroids will set in.
Yeah.
So we actually get children even with viral infections on the face, but because the immunity was messed up with by these steroids, and then the diseases that were not supposed to get them are getting them. You know? Then the skin starts getting very thin, especially in adults, like ladies. You know, they use steroids even for acne, what you wanted us to discuss, and the skin will start getting thin. Some are so thin that you can see the blood vessels actually, and it also predisposed now to other infections, yes, but also other conditions. And most of the time, people will get addicted to the steroids. You cannot withdraw. The moment you withdraw, you get a rebound. So you get a worse condition. So you're addicted. So it's a vicious cycle. Long story short, stop buying over the counter. Okay, stop buying over the counter. And remember, most of our pharmacies are not manned by a pharmacist. You know that. So, or even a pharmacist. Unfortunately, I hope I'm saying the correct thing. So you'll find maybe some people manning a pharmacy or a drug outlet may not be qualified, because there's no pharmacists that will do that actually. They have, you know, the knowledge, you know, what I can dispense, what I cannot do. So please stop doing over the counter. And even if a doctor has prescribed, stop refilling some of the things. So for most of our clients, will tell them, you keep buying this, don't buy this. You know, when you finish this period, come for review. Do not, if there's a problem, come back. So there are those that you'll be told, keep buying, maintain, and there are those who say, keep coming. So if you've been told to use something for 2 weeks and you're using it for months, of course you're doing the wrong thing. And steroids are bad. Let me just finish it. That steroids are bad, but in the hands of a doctor, they are okay if they are used correctly.
It's a good thing you've jumped right to the steroids, because that's what I would wanted to ask next, because definitely I know I'm guilty, and I know so many ladies here are guilty. You cannot be the first to cast a stone. You're definitely guilty. Gone over the counter, the chemist, gotten some steroid. Of course, you can use it on your face because you've gotten this rash, some of us acne, and of course you're bright and it's working, you know. You use it for like 7 days, it's working wonders. Of course, you leave it, like you're saying, you leave for 2-3 days, the rash is back again. So you keep, and then, you know, we're also very clever. We're also doctors in our own ways. We'll get the steroid.
Very true.
And then we'll notice when I use it, they're saying I should not use it for long. So I'll use it for 3 times a week. Then the rest I'll do my normal moisturizer. See, we are good there.
No, we are not. We are not. So a steroid is a drug actually. You know, it's meant to treat. It's not a cosmetic thing at all. And the topic of steroids and cosmetics is one really huge topic. So I'll start with something before I forget. You know that most, I call it mikorogo concussions. Although the clients don't even dispute, they actually just agree. So, and there are a number of people doing this, especially in Isiolo, and there are so many, you know, backdoor people doing all this. Steroids are cheap. Someone might take a steroid, a very strong steroid, and mix with something like Vaseline and put in a very fancy bottle, and you actually buy for thousands. And you'll apply it and you'll look really
very
nice.
good.
This doesn't last actually. And apart from the mikorogo concussions, is that the black market is flooded with these products. So be called lightening cream, brightening cream, and you know they have pictures of these the assumption that a very brown, you know, light person is the beauty, and us black dark brown are not the beauty. So it's unfortunate because that has really been sold, you know, from ever. Since we are colonized, and it's still happening up to today. Actually, that's modern colonization. You know, that you have to use something like to lighten your skin. So those things have steroids. It will never be written, of course. Or they have something we call hydroquinone, which is worse. It will have things like mercury. Mercury interfere with, you know, production of our melanin, our very beautiful pigment, and will get lighter. But that is something that will even damage your kidneys when you use for a very long time. So you're not only talking about the skin, you're talking of things that if you're pregnant, you know, it can mess your child, you know, your kidneys and other internal organs. So it's not a simple topic actually, like, you know, it will spoil your skin. No, it's not. It's such a menace. Okay. And if you just do even simple Google, most of these products that are being used are banned. But no one talks about it. It's a multi-billion industry. No one will talk about them. No one will make noise about them. But they're doing lots of harm. Okay, so those are things that will not go through KEBS, but they are there. They're in our shops. No one will crack them down, unfortunately. You know. But if I have done some literature review, this is a topic that I've quite been interested in. If you take just one of those products and you have them analyzed, okay, so there's a certain percentage, let's say, of hydroquinone that is allowed, and even that you should not use for a very long time. So for some countries up 2%, other countries up to 4%. So if you analyze these products, you find up to 15%. 20%, yes, of that. You can imagine. And they are using over and over. Even our parents used actually, you know. Or steroids, they will not write that it has steroids. You know, but it does have steroids. And most of the time, how you know that these products have steroids is you use for some time and then you can't withdraw, you can't stop. So you have this very nice cream. You try, either you don't have money to buy, and then if you don't use within a week, you have a problem. Then that's already a problem. You know, you should, that's a red flag that it doesn't have. But long story short, what I'm telling people, they are actually safer lightening products. And when personally I say about lightening, I don't mean changing your color tone. I mean you have a problem. You had acne, you have black marks. Okay, you have melasma, those black blotches, you know, and there are so many other things that cause darkening, or just simply you for a very long time been exposed to the sun. When you check, you know, your thighs and your, you know, below here, your lighter. Actually, that is your true color. You know, babies are the same color, adults, you know, and different colors, and our legs different colors. So mostly that's solar damage over time, and our natural protection is producing more melanin. Okay, that's why when you sunbath, you know, you go wherever, or even here, you go outside and you have a sleep. You know what happens? You know, it turns dark. So over time, when that is, you know, you're exposed to that, that area knows that it needs to produce more melanin with time. So sometimes you want your tone to even out or to treat those. We actually treat. Okay, but the lightening things we use are safe. Sometimes you might even use that hydroquinone, but we use it for a period. The same story with steroids. It's this percentage, it's this period of time, because they will backfire later. Hydroquinone will give you even more black things after it backfires, or it will mess with your color totally, and now you have white patches, and now so many even worse things down the line. So steroids, again, dangerous, so many side effects. Please stop using these products. If you can't use basic products, you know, that are known over time, and maybe you have a problem and you want it treated, I would rather you come get some guidance on treating that.
So I was in your office the other day and we were discussing about hyperpigmentation, which is something hits us mostly ladies during pregnancy. And of course, where you find there's some parts of your body that don't look the same as the rest, and over time, other parts are getting back their color, but that part just wouldn't get the color. And you mentioned about chemical peel. And of which now I was asking you, chemical peel. Now, which one do I use? There are so many in the market. I'm like, no. If you're getting a chemical peel, you're getting it from me. So I didn't know that you can get that in the hospital, because in the market we have all these things they are showing. Because when I say chemical peel, I know there was this viral video of a lady that was literally in a bathtub and their melanin is literally being scrapped off. And that's what will come to people's mind. Is that what you meant, or what? What's
No,
that?
no. You cannot scrape off melanin. Please know that all those videos, I've also seen one, and actually that was a Caucasian that did the one I saw, and they were under a tap and they washed, and then you cannot. You can't do that. You can't wash melanin. You can't, apply chemical and
literally
it's washing off. That's impossible. Because it's not a paint. So I mean, it's media. Anything can happen. Can be shown. I mean, so you can't wash out melanin. So the same things I was talking about can be used to lighten. And this lightening is more of taking your skin back to the normal tone that you have.
Yes.
Okay. If you go beyond that, then it's bleaching. It's more of bleaching. It's still brightening, but you get what I mean. And this is then interfering with the production of melanin. So this is way beyond that. So the things that either applying or you're getting IV or you're swallowing, they are aiming in, interfering with how the melanin is made. So it slows down. It's like steps of a machine, different steps. So it's blocking one step. So you don't get the end product, which is now the melanin. So that's what happens. And the moment you withdraw, the process starts. Of course, very few can interfere. You can destroy the actual cell that produces the melanin, and that's the only time you get permanent bleaching. Okay, that's why most of the people, if you can't maintain all these expensive things, you stop, then your normal tone will always come back. For the chemical peel, we don't actually interfere with melanin production at all. So it's, if you have a chemical peel, it's practically chemical. I want to say an acid. There are different ones. There are different ones which it's outside, the people we are targeting right now. So I'll just call it a chemical peel. So there are those pills that will help with actually the darkening, but it's more of already the darkening that is already deposited in your cells, the extra darkening, because you have melasma and all these, the acne, and you've had these black marks, or just the changes in tone. So it helps to even remove the upper layer of the skin, the very, very upper layer that we always shed. So it sort of increases that, and the entire skin turnover will increase, because your skin has to have that specific number of layers. So the moment you interfere, it's like you're waking it up. But also remember, when you're younger, the skin turnover is very fast. When you're getting older, it slows down, and that's why you get a lot of, the bad layer sticking on for a longer time, and it's destroyed by the sun and all this pigmentation, pollution, and all that. So chemical peels helps with that. So it helps you to shed that. That's why after a chemical peel a week, you feel very smooth and you look brighter, because in layman's language, the cells that you already have are just already messed up by the sun, by everything. So you sort of look brighter, but it's more of, that's not bleaching at all. It's more of removing that and getting your natural tone. But also we are aiming to have an even tone, not black, brown, dark brown. So that's what we are targeting, not really bleaching. So you look brighter, the skin will be healthier, and the skin turnover will be higher. So all these darkenings that we've had that have been deposited, I would say that. So you do chemical peels, you're just trying to increase the cell turnover, and then you safely use some brightening creams on these areas. Okay, these most are plant extracts and very many safe things that you can even use for a long time to maintain that. And the safe things will never interfere with the normal tone. The moment that is being interfered with, maybe we give something strong to help, and we realize that is also interfering, we'll go down. We'll taper down and give something else that is less. So we try to balance in treating the bad that you don't have, and you going back to the normal skin tone.
Now you've mentioned about anti-aging. Where That's a very, very sacred topic for most ladies.
True, it is.
So anti-aging creams and whatever they are, when to start? Is it necessary? Is it safe? And do they really do what they're supposed to do? Or are we just wasting our money on them?
Okay, so anti-aging is a very huge topic, but actually I'm also, it's part of what I've done as an extra training on anti-aging or aesthetics. You can just even simply call them aesthetics. So generally, I don't know how much to handle, but generally we start aging at 25 years. And what happens is that your skin turnover might slow a little down, you know, when you're 35, 45 and all that. But you also lose some things, you know. You're losing fat. Can just remember how your kids look like, you know. So you're losing that baby fat. You know, let's call it baby fat. These fat pads, you're losing them. That's why generally over age, the face looks like it's sagging because you're losing the fat, but you're also losing collagen. Collagen is the structure, part of the structure of the skin that really makes it firm. So if you're losing that, also the skin just starts wrinkling. And of course, with all this, the sun makes that loss even faster. Okay. So you start wrinkling and all that. So what happens is, after 25, instead of making more, you're losing more than you're making. Okay. And generally, when we talk of anti-aging, it's just about, there's another professor who used to call anyone doing anti-aging aesthetics your collagen special. I don't remember what he said, but generally, all you're trying to do is actually produce collagen. That's it. Okay. You're trying to fight against the loss of collagen, because now that is what you're losing. It, you're wrinkling, your skin is sagging, and the, you know, these feeling crispies, you're losing it and all that. So now when we come to the products, there are very many things that can help you maintain collagen. Now people, the skinfluencers and all these media people are talking about collagen banking, and that is a very good thing actually. So collagen banking is, right now we are also not too old, so the collagen you have, you hold on to it, but you also try to create more collagen, so that as you lose you're trying to create almost at the same level, meaning you actively have to do something about it. So if you don't do anything about it, you keep losing. So you're not banking. So the aim is to bank. Bank deposits. You know, the more deposit you have, the better. So this is the hype about collagen banking. So there are products that can help with that. No, before we go to products. Sun protection, sun, solar. That's why if you know, we exposed our tummies, for example, and we don't tell this is 30 years, this is 40, this is 50. By then you might never know how old this person is. That tells you that the areas that are not really sun exposed don't go through the damage as much as the sun exposed or the pollution exposed areas. So that's why we are preaching sun protection and sunscreens. So we have melanin. You know, this is God, of course, or whatever you believe in, or the universe. Or the science. So we're in the tropics, we are sun exposed. That's why we have melanin, definitely. So melanin protects you. You go under the sun, you turn black. That's a very good thing. So it's actually, the melanin is protecting your cells. If a Caucasian, a very, very white person came in our, you know, situation, they're not using extra sun protection. So they don't get that good melanin. So do they get skin cancers? Practically, yes. So the damage, they don't have melanin, so they're not protected as much as we are. So they end up their cells get damaged by these very bad UV rays. So they end up with the cells just change and they get skin cancers. We do get skin cancers, but we cannot compare, of course. But we're also saying, of course, humans, we've messed up with the ozone, we've messed up with everything. So what you're saying is that our melanin is not enough anymore. Okay, you have it, it's good, but it's not enough anymore. So we need also to do sun protection. So that's why now we are also doing sunscreens. We have a sun hat, you know, those round brim, not just the simple. And you realize people using this sun hat, like men, they are normal color here, and then I don't know if it's not the same. It's not the same. So that tells you a lot. So a wide brim sun hat, so sun protection. So this pollution and sun will cause you to age faster. So usually what we have had in mashinani is that watu wa ofisi, they look very nice, and then watu wa mashamba, even if they are young, they look very old. So it's not about because you're employed and you have money. Nope, it's because you're not sun exposed. That's why. Okay, that's actually the reason. Someone who's sun exposed throughout, a farmer will look older because of the damage. So that's number one. That works. That if you're going to buy creams and all these things, and you're not doing sun protection, it's a waste of time. So sun protection, number one. Now number two, yes, products do work, but as I told you, unfortunately, we get the wrong product. People are looking not to age, it's more of lightening. They think that is also anti-aging. It's not. Actually, when you bleach and you're using brightening things, you age faster. Because you're even removing what is supposed to protect you. You're making your skin very thin, and you know, or you're making your immunity lower by using these brightening things. So you'll age faster. So for those people bleaching, it's just wrong. It's wrong. If you're treat dark marks, but do not bleach. You're removing your God-given protection. So products, now the problem is which ones are you using? Okay, we do know products that actually does help. If you talk of something with vitamin C, and they're counterfeits, let me start with that. There's so many counterfeits out there. But if you're using something like vitamin C serum, that is good. Okay, if you're using something with peptides, peptides are actually what makes up collagen. That will be good for you, but get the correct ones. If you're using something with a very mild retinoids, but very mild, not necessary every day, those are increasing your cell turnover. If they are good ones, yes, they do work. Okay, there are things that will be called collagen, but what matters is what is making up that product. Yes, they do work actually. Then apart from over the counter, we have injectables. We do even in the office. So there are things we inject and they help you produce more collagen. Now, apart from that, we have procedures. Chemical peels, that's one of them. It's actually also anti-aging. Because the more skin turnover, the more you produce the skin structures. Micro-needling, dermabrasion or microdermabrasion. We do actually put threads, threads inside your skin, very tiny threads. And they help you produce collagen and so on and so forth.
Now, all that is all about still collagen banking.
Yes, because that is what anti-aging is about.
Now, you mentioned about sunscreen and, of course, knowing the right products. And then this thing, SPF. SPF 50, SPF 30. How to tell which one you're supposed to use. And then you also mentioned that we start getting old at 25. So all those 25-year-olds calling us 30-year-olds and above old, you're also old. So there's that. So you start, the right age is 25 to start.
Okay, for the age first, we said you start losing more than making collagen when you're 25 years old, and it's called aging, and it's good to age, but we want everyone to age well, or the old term, age gracefully. So you start losing. You do not have to start using these things, but you sun protection, even children. My children use SPF. They know sunscreen actually. So there are specific pediatric sunscreens that are friendly to children's skin that you can start using, especially when they go swimming, their PE day. You don't have maybe to use every day, but you should know which specific days you put them, you get them.
Because even of late it's been really hot.
Exactly. And they also get sunburns a lot actually. So get them sunscreen. So this you can say sunscreen is part of banking because you're protecting what you have. That one you start earlier than 25.
Yeah.
At 25, usually we don't bother them much. But if you go to Western countries, yes, they start. Actually,
the
some go
anti-aging
even,
and all
yes,
that. Yeah.
some will go even below 25.
Yeah.
So it depends who is seeing you and how. If it's about money, they will say so many things.
Yeah.
But they will guide you on to specific areas. But generally, there's nothing wrong with microneedling. It doesn't matter at what age. You know, there's nothing wrong with chemical peels. It matters whose hands you are under and what type of pills and what you're aiming to get. And you know, there's nothing wrong with actually something that like vitamin C. It's also an antioxidant. It's good to use vitamin C during the day because it protects you also against pollution and all that. So if you're using that at that age, that's fine. Okay, so they don't have to, but they can start their banking. The earlier the better. If I'm treating someone who is 45 and another one is 65 and you know the same procedures, everything, the improvement will never be the same. Someone who is younger will always have better
results,
you know,
and
faster and you'll be able to make more collagen, you know, more than someone that is 65. So it's good to start earlier than later, but then there's no late. There's no, people come to my office, they're 70 years old and above. There's no saying you're too old. So you have to listen, you have to see what their concern is, and then you handle that concern accordingly. It doesn't matter. If you have wrinkles, we can handle the wrinkles. But we also don't want to make you plastic. We will reduce and will make you comfortable. But there are those that it's so extreme and we go a step further and they have to go under the knife, of course. But most of the things will just handle it with minimal invasion. So we call it minimally invasive aesthetics. And that's what I practice actually. The more invasive aesthetics mostly will be practiced by the plastic surgeons.
So the SPF,
I didn't answer that.
Time is really running out.
SPF,
I think we'll just have you again and again just to handle things.
There's so much to say. So SPF just means sun protective factor or sun protection factor. So they already our melanin is SPF because it's sun protecting, but we need to add. So like for our color, SPF 30 is enough. But what we say is that you need to at least redo once, especially if you're under the sun. So if you work in the field or, you know, you're a farmer or you're always outside or you've gone for an event, if you do SPF 30, even SPF 50 actually, it's just good to add during the day. So, but SPF 30 is enough. For most of us, you know, working somewhere inside, SPF 30 is actually adequate. But then if you are walking outside to go to the, you know, somewhere, just put on a sun hat. You're good to go. So there are people actually who have conditions that need sun protection. Or let's say you have melasma and this darkenings you're talking about.
Albinism.
Now that's a whole topic. So you need SPF at least 50. And you also redo during the day. And these are people, so you have to have a sun hat and all that. So the higher the protection, so there's no harm. I use SPF 50 actually myself. There's no harm with doing a higher SPF. But SPF 30 is just enough for most of us with no extra issues. But if you have issues, 50, and there are those that will actually add every 3 to 4 hours, depending with what we are dealing with and where they are. But I need to mention, sometimes even sun through the window is an issue. People driving, you know, through the window is also an issue because people assume as long as you have something on top, it's not. So we need also to check on that. So most people driving a lot, you realize their right side, we keep that right, their right side, their right side, I'm trying to imagine it. Actually their right side is worse than their left side. You need to be keen to see that, but it's there. Most people, especially men.
Now, as we are we really need to wrap up, but They'll kill me if I don't ask this. Of course, like you've mentioned vitamin C's, you've mentioned using products with peptides, but now we have so much in the market, so many serums.
True.
Until you don't know what to use, what not to use, what is the basic things, like what are the basic things to use?
If I'm to say basic things, if let's say someone has acne, oily skin, pimples, niacinamide serum can help. Okay.
Yeah.
If someone has, these are the basic things. If you have a very dry skin, you know, really it even gets irritated, hyaluronic serum is good to use.
Yeah.
Okay. If it's just you know, wrinkling and, you know, signs of aging and, you know, that roughness, a retinol serum, you know, retinoic, they have different names. Serum is good to use, but remember the retinol serums can irritate. That's okay, it's acceptable, but then you need to use it. You can build up. You can start twice a week, then you build up. You don't need even to do more than 3 times a week for the retinol serum. And then we have, if this just collagen formation and nothing big happening, you can use those peptide serums. If everyone can use vitamin C serum because it's an antioxidant usually during the day, so that's okay. So if I had even acne, if you have acne, niacinamide, retinol, vitamin C, those are serums you can play around with. Dry skin, then hyaluronic, I've said that, but you can do hyaluronic and during the day do the vitamin C serum. Those are actually the basic serums, and I think those are enough for just everyone to know for skincare actually. And then you can always add on your moisturizers even on top of the serum, especially it's very light serum. And those who don't like, you know, having many layers, in the morning you can do your serum and do your sunscreen actually. So most sunscreen will also moisturize. Okay, but people should also moisturize, especially men. They need to moisturize the skin. Also, that dryness is not good for skin and skin aging and skin turnover. So it's good to moisturize your skin and then do some sun protection. So if you're able to do just that basic thing, fair and well. For the products, if you have acne, oily skin, you can look for products that are either water-based. If it's makeup, there's water-based makeups. And if you can look for oil-free, you know, products, you know, some will be written for acne skin, comedogenic, non-comedogenic, and things like that. If you have an oily skin, if it's the opposite, dry skin, then you don't use the drying ones or something like that. If you have an oily skin, you can go for foaming cleansers. And then if not, normal cleansers are okay, but you might not even need to do the cleansers. The toning, you really, I'm a minimalist, really. And unfortunately, there's so much hype. And there's so much information, and most of that you do not need actually. Most people will come to my clinic with a million things and you just reduce to 2 or 3, because sometimes skin just needs also some
time to
some
even
rest.
breathe. So just normal soap, and then just
mild soaps are okay. So most people actually we treat because their skin is irritated from so many things, alcohol based things, toners, I have nothing against toners. You just need to know when, at what time. If you're toning, then there are those other things you need to use. You know, we need the pH of the skin to be, you know, the right pH, because some things will be too acidic, too alkaline, and then we have an issue, because it will actually practically break the barrier that we were talking about. So we need a balanced barrier. Okay? So some people saying sensitive skin, it's actually a true thing. People get sensitive skin. So when you come to us, you have a sensitive skin, we now look for the diagnosis. So likely one of your barrier, there's the cells, there's the lipid layers, and then there's the acid mantle. We call it an acid mantle. Likely something is wrong. It's broken there. Sometimes we just ask for your product, and likely your sensitivity might be from your product. And let me just mention this. Mostly the physical cleansing, you know, that rough, the very rough thing. We are trying to discourage that as especially for the face. Good for your body, that's fine, but for your face, we are trying to discourage that because it's really interfering with the skin barrier. So it's safer to do the actual cleansers than to really use that physical thing. But yeah, that's a guide on how you can choose what you really want to choose. But then if there's a problem, we can guide accordingly. Yeah.
So I think personally what I've gotten from all this, if you're really out there wondering what to do or where to start on skincare and everything, just visit a dermatologist to get just a guidance. You know, you went to school for all these, and then we are here, especially nowadays when you go to on social media, you're getting this information from one influencer, another one is telling you know, use this, and of course some of these people have been paid by these companies to advertise their products, which may not necessarily do what they are saying that they do. Daktari, thank you so much for the time and, you know, analyzing everything down for us. We'll definitely have you again and again because definitely skincare and skin conditions are so broad. We cannot cover all of them. Thank you so much for being here and we wish you well.
Thank you for having me.
Thank you so much, guys, for staying tuned. I'm sure today you've learned a thing or two. And in case perhaps in the topics that we've handled, there's a question you felt that I didn't ask, something that you really wanted to learn, you can always send us your questions and we'll direct them to Dr. and she'll be able to give you the answers that you need. Remember, our main sponsors, Grace Park Medical Center, do have dermatologist clinics where you can also get your answers and guidelines on skincare, eczema, and any other skin condition that you may be presenting with. Grace Park is located at Union Square Building, Meru, Makutano, Nanyuki Highway. You cannot miss that building. We'll put in their number where you can call and get directives and also get any information that you need. Our beautiful location, definitely Esri Hotel, where they have different packages for you, very affordable and very serene. Have you subscribed? Or you've just bumped to us and you've not subscribed yet, you've been watching our episodes, definitely by now we've convinced you. Please kindly subscribe, like, share, comment. You want to work with us, we'll share our number there. You can work with us, advertise with us in all our socials, Facebook, TikTok, Instagram. We'll put in all the details. Thank you so much. Until next week, bye-bye.
2 weeks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges